Hi everyone, welcome to week 2 of your Medical Language 1 course. This week we're going to start looking at some of the systems. Remember we talked last week about how the cells, are just the very small part of the body, and we eventually work our way up into systems. So this is the first system that we're going to look at. It is called the integumentary system. The integumentary system is mainly the skin. So when we talk about the skin, that's what we're talking about, the integumentary system. As you go through and you read this chapter, you're obviously going to want to look at the functions of the skin and things like that. You're going to want to make sure you understand the different layers of the skin. But just as in your Medical Language 2 course, when you started on a system there, I want you really to focus on some of the terminology as it relates to conditions and the medications used for those conditions. So this entire PowerPoint will be available to you within the course, but I want you to be able to, I want to focus really on those conditions right now. Here are some of the conditions that you're going to read about. We've got the term alopecia. If you've ever heard anybody talk about losing their hair, that's called alopecia. That's the medical term for it. We've got things like blisters and burns and cellulitis, cyanosis. We've got dermatitis, ecchymosis, eczema, erythema. So these are all different types of conditions that you will read about. And there's several more. There's things like gangrene, hives, impetigo, which is very common in small children. You can actually have things like cuts and scrapes and that kind of stuff, which would fall into this. And so once you familiarize yourself with some of these conditions, there's another one you might know, psoriasis. Here's a couple more. Systemic lupus is actually considered a condition that's part of the integumentary system. So once you get through, familiarizing yourself with these different conditions, then I want you to make sure that you are learning some of the different medications and some of the drug terminologies that go along with this. Some of the medications that you're going to see frequently used on conditions of the skin, bacitracin, that is a antibacterial. It's to treat bacterial growth. Betamethasone is actually used to treat inflammation. Anything you see ending in zone is going to have some sort of inflammation, anti-inflammatory properties, I should say. Clotrimazole is used to treat fungal growth. Diphenhydramine, you might know that better as Benadryl, and there is both a topical and an oral Benadryl. And so that's used to treat allergic reactions. Hydrocortisone is to relieve itching. And again, it ends in that zone. And so part of the function of hydrocortisone, how it helps to relieve itching, has to do with inflammation, reducing that inflammation. Lidocaine, anything ending in the canes, is going to be used for pain relief. Then there's some other drug terminology that's discussed at the end of this chapter. These are just some specific types or categories, I guess you could say, classifications of drugs that you're going to want to understand. Specifically, anesthetics. Anesthetics are going to relieve pain. It's going to actually block pain. Anti and then bacterial. From what you learned last week, you should know that the anti means it's going to kill or do something like that, and then bacterial is telling you it's bacteria. Antibiotic is going to control or kill the growth of microorganisms, and antifungal is going to kill fungi. So not everything is going to be treated with, quote, an antibiotic. We have to know specifically what that microorganism is. Is it a fungus? Is it a bacteria? Is it a viral thing? So then we've got this group. We've got antihistamines, anti-inflammatories, antipyretic. Antipyretic is something that you'll see when specifically, one of the things you'll see that most likely used for is chickenpox, and you'll also see it used for things like poison ivy, poison oak, that kind of stuff. A couple others that I want to make sure to point out to you is corticosteroids. Corticosteroids has that anti-inflammatory property, so things like hydrocortisone are going to fall into that classification. Emollients are used to soften the skin and, smooth things out. So again, the focus in all of these chapters is going to be learning about some of those pathological conditions, disease states, and the drugs that are associated with them. As always, if you run across any problems or have any questions when you're going through the material, please reach out to me. Give me a call or send me an email or text. My number is 618-792-2293. Have a great week.